My patient's receiving intermittent feedings using an enteral feeding pump, and his pump's broken. There's no other pump available from the processing center.
Well, then we'll switch to a gravity system in order to deliver the nutrition, okay?
That's great, thanks.
That's why I'm here. Now just remember to check the order for the type of feeding formula, volume and frequency, and then gather the supplies, okay?
Okay, great.
Thanks.
Hi, Mr. Torres. This is Miss Swenson, my instructor.
Hello.
She's going to be helping me give you your nutrition supplement. Since the pump's not working, we're going to have to deliver it by gravity. That'll take about a half an hour. Once it's done, I'll disconnect the tubing, okay?
I'm at your service.
Okay, great. I'm going to just check your ID band first. Can you tell me your full name?
Carlos Torres.
Okay. Now I'm going to position the head of the bed at least 30 degrees, or as near normal eating position as possible. Are you good there? Okay. Lift you up a little bit.
Now hang the feeding bag set on the IV pole and adjust it to be about 12 inches above the patient's stomach.
Okay.
Now clamp the tubing on the setup.
Now I clean the top of the can with an alcohol wipe, right? Okay, now I'm going to pour the formula into the feeding bag.
Okay, be sure to open the roller clamp and run the formula through the tubing to purge the air.
Okay, all the air is out. I'll close the clamp again. Now I'm going to check the residual, or the amount of feeding that's left in the stomach from the last feeding. I'm going to have to pull your gown up just a little bit, okay, Mr. Torres? I'll be sure to use a waterproof pad.
Great. Now aspirate gastric contents with a syringe and measure. Then you want to return the contents immediately through the tube.
I'll put it back in. Now I'm going to flush with 30 milliliters of water. Okay. Since the residual did not exceed the facility policy or the doctor's orders, I can continue with the feeding.
Very good. Clamp the PEG tube. Now attach the feeding setup to the feeding tube. Open the roller clamp.
Okay.
And adjust the drip rate according to the infusion time ordered, or allow it to infuse over at least 30 minutes.
I've calculated a drip rate of 80 drops per minute.
Great.
Okay, Mr. Torres. We'll be back when your feeding is complete.
Sounds good to me.
Hi again, Mr. Torres. How you feeling?
No dramatic changes.
Okay. What I'm going to do now is I'm going to flush the feeding bag with 30 milliliters of water. That way we can flush out the bag itself and your PEG tube at the same time. I'll draw it up in here. That's 30.
Then clamp the tubing as soon as the water is instilled.
Okay, now I'll disconnect the tubing from the peg.
Apply the cap to the end of the tube, Jeannie.
Okay, Mr. Torres, I'm going to have you sit in an upright position for 30 to 60 minutes. Is that okay?
That I can do.
Okay. If you have any questions or concerns, don't hesitate to ring your bell.
Thank you, Mr. Torres.